And what if I told you that the itch that keeps you from sleeping, that persistent itch that you might attribute to dry skin or age-related issues, could be a warning sign of something much more serious? It sounds unsettling, and it's important that we pay attention to it. I am Dr. Marco Palma, a nephrologist, and I dedicate my life to the health of our older adults. Today, I want to give you information that all doctors wish people knew. There is a silent danger that many ignore, a cry for help that your own body is sending you. A simple itch, when it appears persistently in 3 very specific areas, can be one of the first warnings of a serious illness that is progressing without you realizing it. Today, I will reveal the 3 areas of the body where intense itching is a red flag that you can never, ever ignore, especially if you are already over 50 or 60 years old. Stay with me, because understanding this in time can be the difference between a long, healthy life and a diagnosis that comes too late. In my years as a doctor, I have seen stories that could have had a very different ending. Patients who come to my office with kidney damage that is almost irreversible, or with liver problems so advanced that treatment options are few. And when we trace back their history, we usually find a common symptom that was ignored for months, sometimes for years. An itch that wouldn't go away. Most think that the itch comes from something external, the bite of an insect, an allergy to a new cream, or the rubbing of a fabric. And yes, many times it is that simple, but we must understand that our skin is like a mirror of what happens inside. It is a giant organ that can reflect the health of our deeper systems. When the organs that cleanse our body, like the liver and kidneys, start to fail, they don't always hurt. Sometimes, instead of obvious pain, they send subtle signals. One of the most common is an itch that has no logical cause on the surface of the skin. It's like the check engine light that comes on your body's dashboard, and today you'll learn how to interpret it. Imagine this scene, because I have seen it many times. A person, let's call him Carlos, 65 years old, starts to feel a terrible itch in his shoulders during the night. It keeps him from sleeping. He scratches until he hurts himself. His family tells him, "Dad, it's just age. Your skin is drying out. Use this cream." Carlos tries one cream, then another, then another. He spends money on lotions and remedies that do nothing. The itch remains there, in that same spot, constant. What Carlos and his family don't know is that this itch has nothing to do with dry skin. It is a cry for help from his kidneys, which are silently failing. They have stopped filtering the blood toxins properly. This buildup of waste and the mineral imbalance it causes, like calcium and phosphorus, irritate the nerve endings from the inside out. His body is not asking for a cream, it is desperately asking for a treatment that will save his life. When it finally arrives at the doctor, alerted by other symptoms like inflammation or extreme fatigue, the damage is already significant. This story repeats itself with liver diseases and also with certain types of cancer. The problem is that we get used to treating the superficial symptom, not asking ourselves, why is this happening? And when we talk about persistent itching in an older adult, ignoring the underlying cause is a very high risk. Early diagnosis is everything, and this itching could be your first and best opportunity to act. Now let's get to the important thing. Not all itching is an emergency, but if it appears intensely and persistently in these 3 areas, you need to pay close attention. The first place that should raise suspicions is, perhaps, one of the strangest: the palms of the hands and the soles of the feet. If you feel intense, deep itching, almost as if it comes from within, and it intensifies significantly at night, this is a giant red flag. I'm talking about itching that does not relieve by scratching because there is nothing on the surface. You can look at your hands and feet and see absolutely nothing. No rashes, no redness, no dryness. But the sensation is unbearable. This type of itching, known as cholestatic itching, is a very important clinical clue that can indicate a problem in the liver. What is happening here? Your liver is the purification plant of your body. The liver produces bile for digestion and eliminates waste through digestion. When the liver is diseased, or its ducts become blocked, this flow is interrupted. Some substances that should be eliminated, such as bile salts, accumulate in the blood. Today, we know that it is a complex process, where different compounds end up irritating the nerves of the skin. For reasons that are still being studied, this irritation is felt with special intensity in the palms and soles. Ignoring this signal can delay the diagnosis of an underlying liver disease until it is in an advanced stage, such as cirrhosis or liver failure. If you feel this unexplained irritation in your hands and feet, don't go to the pharmacy for another cream. Ask for an appointment with your doctor and request a blood test to see how your liver is functioning. The second type of itching is not limited to one spot, but its nature is unmistakable. I am referring to generalized itching that comes and goes and can affect your entire body, but is often felt more intensely in the shoulders, back, and folds. It is an itching that drives you crazy, that gives you no respite. This can be an indication of chronic kidney disease, as in Carlos's case. It is known as a uremic pruritus. When the kidneys, our filters, start to fail, urea and other waste products that normally go into urine accumulate in the blood. As I explained to you, this accumulation and the imbalance of minerals in the body are one of the main causes of this systemic itching. It is an internal problem, not a skin issue. In very advanced and uncommon cases, you may also see a white powder on the skin, known as uremic residue, which are crystals of urea. The most dangerous thing about chronic kidney disease is that it is a silent killer. You can lose a significant part of your kidney function without having clear symptoms until signals like this unbearable itching, fatigue, inflammation, or cramps appear. By that point, the damage can be severe. If you are experiencing itching all over your body that does not improve in any way and feels deep, especially if you also have high blood pressure, diabetes, or family members with kidney problems, it is essential that you consult a doctor. A simple blood and urine test can detect a kidney problem in time. The third place is the most insidious because it is small and localized. I am talking about persistent itching in a single spot on your body. It could be a mole that usually starts to itch, a small rough patch that won't go away, or a wound that seems never to heal and always itches. Many dismiss it thinking, surely something has bitten me, or it's just a pimple. But this localized itch can be one of the first signs of skin cancer, such as basal cell carcinoma or the more dangerous melanoma. Why does it itch? Cancer cells, growing uncontrollably, can release substances that irritate the nerve fibers in the skin. Sometimes the itch appears even before changes in the lesion are very evident. The famous ABCDE rule, asymmetry, irregular borders, varied color, large diameter, evolution or change, is key to detecting melanoma, but I would add the P for pruritus. Additionally, although less common, a generalized itch without an apparent cause can also be a reaction of the body to an internal cancer, such as lymphoma. The rule here is simple. Any new lesion on the skin that itches, bleeds, changes shape, or does not heal within a few weeks should be evaluated by a dermatologist. And if a mole you already had starts itching for no reason, it's a sign to seek a doctor's appointment without delay. Don't procrastinate. I know that what we've just talked about is alarming. It's normal that right now you're thinking about every itch you've felt lately, mentally reviewing your skin. I completely understand. Hearing the words cancer, kidney failure, or liver failure is frightening, and it's a human and natural reaction. But before panic sets in, I want you to take a deep breath, because the key is not to live in fear, but with knowledge. Let's quickly recap. Intense itching in the palms and soles, especially at night, think liver. Generalized and distressing itching in the trunk and shoulders, think kidneys. Itching in a single spot, on a mole, stain, or lesion, think skin cancer. Now, let's take a deep breath. Most itching is due to benign causes. The most common, especially in older adults, is dry skin or xerosis. Other frequent causes are dermatitis, allergies, or stress. These usually improve with basic measures such as drinking enough water, using mild soaps, preferring cotton clothing, and applying a good moisturizer after showering. But if your itching is different, lasts more than 2 weeks, is so intense that it keeps you from sleeping, does not improve with basic measures, or is accompanied by extreme fatigue, weight loss, fever, night sweats, or a yellowish color on the skin, do not hesitate for even a second. Consult your doctor. Your body is speaking to you. Learn to listen to it. Thank you for following me. I am Dr. Marco Palma, and your well-being is my priority.